Well, good afternoon. A week ago, I stood at this podium and announced our plan for stage 2 of reopening our province. On Friday, thousands of businesses were able to open their doors. Thousands of people were able to go back to work in 24 regions of our province. And just as we promised, we're providing another update. Today, we continue to report lower than 200 cases of COVID-19 here in Ontario. This is the lowest day-over-day increase we've seen since late March. And while our cases continue to trend downwards, our testing numbers are climbing. Here in Ontario, we've processed over 1 million tests since the start of this outbreak. And I want to thank each and every one of you, because it's your commitment, your dedication, and the progress we've made together as a province that has saved lives and sent more people back to work as we continue to reopen the economy. And over the weekend, our team crunched the numbers. Our Chief Medical Officer of Health and the command table reviewed the data and provided the recommendations. On their advice, I'm excited to announce today that as of this Friday, the following regions will be able to enter stage 2. Durham, Hamilton, York, Halton, Niagara, Haldimand, Norfolk, and Sarnia-Lambton County. This will mean more people going back to work at restaurants, bars, beauty salons, shopping malls, and many other businesses, big and small, in those regions. For the regions still remaining in stage 1, Toronto, Peel, and Windsor-Essex, we ask you, please be patient, because we can't let our guard down. But the good news is the public health trends across the province are going in the right direction. We're making steady progress. And if we keep working together, I'm hopeful that all communities in Ontario will be able to enter stage 2 very, very soon. We want to get more people back to work and back to their lives as quickly and as safely as possible. My friends, if we keep looking out for one another, if we have each other's backs, we'll rebuild what we've lost and more. Thank you, and God bless the people of Ontario. I'll now turn it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. As we outlined a week ago, beginning this Friday, our government will allow more regions to ease restrictions and enter stage 2 of the reopening process. The reason we're able to do so is in no small part thanks to the considerable and ongoing efforts of all Ontarians to stop the spread of COVID-19. Your continued diligence with physical distancing, wearing face coverings when needed, and hand hygiene has helped to make today possible. Because of these efforts, and as the Premier just announced, 7 more regions will enter stage 2 on Friday, joining the 24 other regions that reopened last Friday. We are making progress in our fight against COVID-19. There's no question. Every day, a clear majority of public health units report fewer than 5 cases, with many of them reporting no new cases at all. Ontario's testing is at historic levels, with the province now having processed over 1 million tests. As a result, our positivity rate remains at all-time lows. At a local level, public health units continue to conduct rapid case and contact management to ensure we identify and isolate new cases to contain the spread of COVID-19. Together, we're moving another step forward and doing it in a way that maintains our first priority, the health and well-being of all Ontarians. Thank you. Now I'm happy to pass it over to Minister MacLeod.
Thank you, Premier. Thank you, Minister Elliott. The past few months have had a devastating impact on Ontario's heritage sport, tourism, and culture industries. We were hit first, hardest, and will take the longest to recover. Before COVID-19, these industries fueled a spectacular double bottom line, contributing more than $75 billion to the provincial economy and enriching our unique cultural identity. Now, they face the daunting task of overcoming a triple threat: the public health, economic, and social crisis brought on by this pandemic. It's why we were proud to immediately flow more than $200 million to support these critical sectors, in addition to these next steps. We're investing $13 million to encourage Ontarians to explore the beauty of their own backyard. We're launching virtual platforms like Ontario.live to help small businesses extend their online reach. And I'm embarking on a province-wide tour to showcase what I like to call the world in one province. By focusing our support through local marketing campaigns and staycations, we'll be ready to welcome the world back to Ontario when it is safe to do so. Until then, I'll be in Niagara Falls on Friday to celebrate its reopening, and will continue to work day and night to restore consumer confidence in our heritage sport, tourism, and culture industries. Thank you, and I'd like to now pass it over to Minister Phillips.
Thank you, Minister MacLeod, and thank you for your leadership in supporting those very important industries. Last Friday, 24 of our 34 public health units moved into Stage 2. This Friday, as you've heard today, another 7 will take that important step. While our focus remains on safely reopening the rest of the province, the work of restarting a $700 billion plus economy is understandably complex. That, as we saw this weekend in the regions across Ontario that reopened, gave us confidence. We saw people acting responsibly towards each other by following public health advice. We saw businesses doing their part by taking the public health guidance seriously and by working together to build confidence amongst employees and customers. A great example is the Post Promise, which calls on businesses to take 5 key actions to stop the spread of COVID-19. Over 100,000 companies are participating in this initiative to assure customers and staff they are doing their part to protect Canadians' health. I want to congratulate the Business Council of Canada, the Canadian Federation of Independent Business, the Retail Council of Canada, Restaurants Canada, and the other organizers of this important initiative. We know that if people know what they need to do to fight COVID-19, they will do it. So we'll continue our public service advertising to communicate guidance in a timely and clear way. I encourage employers to visit ontario.ca/COVID to access over 100 workplace safety guidance documents and helpful videos that we've made available. Or they can call 1-888-444-3659 if they have questions. We all need to continue doing our part. Work is underway with the input of thousands of people across our province, planning for what is required to ensure a strong recovery here in Ontario. And now I'll hand it over to Minister Fedeli.
Good afternoon. This pandemic has certainly been like nothing we've experienced before, but so has the response from business owners, workers, and families. The response has truly been extraordinary, and thanks to those ongoing efforts, we will recover and ensure our economy emerges stronger than ever. Through the Ontario Together portal and the Ontario Together Fund, we have mobilized Ontario's manufacturing and innovation might. Thousands of businesses are developing Ontario-made solutions. Today, we are pleased to announce that we are investing through the Ontario Together Fund more than $526,000 into CSA Group testing and certification. With our government support, the Canadian Standards Association will add new capacity to test and certify medical-grade protective equipment, including masks, surgical gowns, and gloves. The project will ensure that critical products are tested, inspected, and certified right here in Ontario. This means we can be more self-sufficient as a province and better prepared for the future. Our entrepreneurs and innovators are the best of the best. They've stepped up with solutions to help us all at a critical time. With more regions entering Stage 2, we will continue to prioritize Made in Ontario solutions to ensure a safe reopening and recovery. Together, we will ensure Ontario continues to be prepared for all circumstances, rebounds from this pandemic, and maintains its place as the economic engine of Canada. Thank you.
Okay, we'll go to the phone line for questions.
I just want to add one comment. You know, philanthropy has always been so helpful when it comes to hospitals, when it comes to charitable organizations. And there's so many families that have given back. They've done very, very well in Ontario and in Canada, but they never forget their roots. And one family really stands out is the Rogers family. I've had a conversation with Edward Rogers, and his entire family are giving back $60 million right across the country. And 21, I think 0.6 is going to be right here in Ontario. And just a shout out to the Rogers family. We're very, very grateful, not only here in Ontario, but right across Canada. And we appreciate all the support in all different areas that you're donating. So thank you. I appreciate it. Now we'll take questions.
Okay, first question.
First question comes from Michelle Maluski from CTV Windsor. Please go ahead.
Hi, Premier. Thanks so much for taking my question. I feel like it's probably a question that the minister might have to answer.
Sure.
Wondering why specifically Windsor-Essex is stuck in phase 1.
Sure. I'm going to pass it over to Minister of Health. I did have a good conversation with the mayor down there, and I just asked the people in Windsor, please be patient, and we're going to get there very, very soon. I'll pass it over to Minister of Health.
Well, we're assessing regions constantly, but unfortunately the numbers in Windsor were still higher than we'd like to see, along with those in Toronto and Peel. And so we're very close in Windsor. There are a number of people, even including health professionals, that work cross-border and come back and forth on a daily basis. But it's very close. I hope that you'll have just a little bit more patience because we are, as I said, analyzing on a daily basis. So I'm sure it will happen very soon. We just need to get the numbers down a little bit more.
Follow-up?
Either one can answer this. I do know the mayor was asking specifically for the province to show, quote, provincial leadership and get tackling the issue in the migrant worker population, specifically with potentially mandatory testing. Is that something the province is considering, mandatory testing in the migrant worker population? Well,
I had a great conversation with the mayor over the weekend. That conversation came up, and anyone with an outbreak with migrant workers, we're going right in to those areas, and obviously voluntarily they'll have to take the test and cooperating with the farmers as well. But I think it's so important that we test anyone that has an outbreak, and no fault of their own. They're living in tight congregate areas, and we've also given the farmers money to make sure that we support them on PPE, support them on making sure if they have to make a few renovations, but we are focused on that area.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Thank you. Premier Ford, good afternoon. There have been questions before with this reopening in stage 2 region by region. There have been questions before about traveling from a stage 1 region into a stage 2 region to get patio lunch, for a hair appointment, anything like that. Now, before, that was a matter of driving from one region to another, but now you could do it just by walking across Steeles Avenue. How can you stop the spread from a high zone, a high number of cases like Toronto, into an area with a low number of cases like Vaughan, or say from Mississauga, for people just crossing into Oakville?
Well, we've consulted with the chief medical officers of all 3 regions, and through the health table and through the advice of the chief medical officer, we're hoping very shortly that we'll be able to open up the other regions. And I understand what you're saying, and that goes back to a month and a half ago when I was saying, hey, let's do it all together. But certain areas were having outbreaks, and other areas weren't. But I hear you loud and clear. We just want to make sure that Peel region and Toronto and Windsor get the numbers lower. And by the way, all regions are doing much better, but it shouldn't be much longer. We just ask people for their patience.
Follow-up?
Again, to the Premier or perhaps to Minister Elliott, whichever one of you would like to take this question, but based on the current patterns of what you're seeing in terms of caseload and where they are, when could Toronto expect to enter stage 2? And if you can look as far ahead as the possibility of stage 3, would we expect to see the same regional map as a schedule for reopening for stage 3?
Well, we had that conversation before I passed over to the Minister of Health. I had a good conversation with Mayor Tory, Mayor Brown, and Mayor Bonnie Crombie as well. And we had that conversation. They understand the situation, and I understand they want to open up, but we're going to do it carefully and safely to the best of our ability, working with the regions. I'll pass it over to the Minister.
Well, we do want to make sure that we can do it carefully in a very measured way so that we don't have further outbreaks of COVID-19, because people have been so good, all 14.5 million Ontarians. Up to now, it would be terrible, especially with the weather getting nicer, to have to go backwards and close things up again. We don't want to do that. That's why we're doing it in this very careful way, to make sure that it is safe in order to proceed. So that's why there have been discussions with the chief medical officers in those local areas to make sure that they concur with the discussion that's happened at the command table with Dr. Williams and the public health experts at the table. And both in Toronto and Windsor, they have certainly agreed with Peel. There are still some public health concerns there that we need to deal with. So we want to make sure that we can keep everybody in Ontario safe and healthy.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Thank you very much. Premier Ford, just to piggyback on Mark's question there, is your plan, though, in your mind, you'd like to see Toronto, Peel, and Windsor-Essex at stage 2 by next Friday? Is that the ideal plan in your mind? Well,
I can't put an exact date, but it'd be ideal if we could do it on Friday. And you know, again, I'm going to go back to the chief medical officer of each region plus our chief medical officer. But I'd love to see it open by Friday. I guess that's everyone's goal. But again, it depends on the numbers.
And my next question is actually for Minister Elliott. Minister, now that we have more regions in stage 2, more coming this Friday, I know we mentioned this a couple of weeks ago, but when do you think updated modeling projections will be released to the public, both for cases and deaths? Now that we have more, do you have a date in mind of when you would like, when those new modeling numbers will be released?
I can't give you an exact date for that, but I can tell you that that was something that we discussed at the Health Command table this morning, about having more modeling done to help us as we continue to emerge and open up Ontario's economy. So you will be hearing about it, but I can't give you an exact date yet.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Brian.
Premier Ford, you've received some very public pushback in the past from mayors Haldeman, Norfolk, Mississauga, Brampton, to a degree Toronto, on not opening up. Did you receive any pushback from them, their chief medical officers, to say that they didn't want to open up this week? Was local consideration part of your consideration in making these decisions? No,
they were very cooperative. They always have been. And I haven't talked to either mayor and Alderman Norfolk, but I spoke to the other mayors, and they were understanding. They want to open up safely too, and they've been very collaborative with us. I know prior they didn't want to open up, and we listened to the local chief medical officers plus our chief medical officer, but they understand. Our goal is to try to get Peel Region and Windsor-Essex and Toronto open as soon as possibly, safely. That's the most important focus that we're focusing on.
Follow-up?
I'll put this follow-up either to the Premier or any of the ministers that want to take it. A few of you might touch on this. You've talked about trying to reopen the economy and get it going again. In accommodation and food services, we've got an unemployment rate in Ontario that currently sits at about 47%, 25% in information, culture, and recreation. The tourism sector has been decimated. How do you get that going again when we're starting to reopen just before Canada Day and not even fully? You've got all your economic ministers there that touch on these files. How do you or how do they give these sectors the boost they need to recover something of this season?
Yeah, so I'm going to say a few comments. I'm going to pass, I've never done this, but because they're all involved, I want to pass it to all three ministers that are involved with the economy. The first thing we need to look at, and we've had this conversation with quite a few mayors, we're going to continue on carrying on this conversation, is regulations. Regulations and red tape kills companies. I had a note from a really smart financial person, an economist, sent over a note to me and said, Doug, I was talking to a business person, and they moved $500 million down to the U.S. because they could get building permits and get buildings going in 6 months. And up in Ontario, in different regions, I'm not going to mention the region, but it would take them 2 to 4 years. So we're going to work closely with these municipalities, and make no mistake about it, the province plays a big role in regulations too. So we're going to need to work with them, and not to skip anything. Make sure we dot our I's and cross our T's. But why can't we get a building permit in 6 months nowadays? Because we're losing business south of the border because they're doing everything, including backflips, to attract these businesses. So we need to sit down and work collaboratively and come up with a strong plan that we don't delay these building permits and we move forward. And it's not one particular city or town in Ontario. It's right across the region. It takes forever to get the building permits. So I'll start off with Minister Fedeli, then over to Minister Phillips, and over to Minister MacLeod.
Thank you very much, Premier. With respect, I'll leave the tourism aspect to Minister MacLeod to answer, but I can tell you the Premier hit the nail right on the head in terms of red tape and regulation. We toured a company this morning, and all of the stakeholder calls that we've had, all the video conferences, that is the single #1 issue. You know, the Premier has been very clear that we need to have a made in Ontario solution. We want to see more products manufactured here in Ontario. That's why we have a $50 million Ontario Together Fund. We've seen 5 companies now be able to be awarded investments from that fund. We're going to continue down that path. We've been talking very heavily, as the Premier said very early in this, we don't make enough pharmaceuticals here in Ontario. We're sitting down with the pharmacy companies, pharmaceutical manufacturers, and asking them, what's it going to take to make more of your product here in Ontario? So you'll hear more from us because the Premier's had great leadership. Made in Ontario, make it in Ontario. With the one tour we took this morning, this company has 3,000 products. They make about 1,000 of their own and 2,000 they import. And we picked up a couple of them and said, you know, what would it take, maybe not for you to make it, but you pack this in your product. What would it take for somebody in Ontario to make this product and this other product? And so that's our approach. This is real guerrilla marketing, and we're going to continue to do that with all across Ontario with all of our companies.
Brian, since we were struck with COVID-19, we knew we'd have to focus on reopening the economy, and that's the phase we're in right now. But there's also been a great deal of work done, and the Jobs and Recovery Committee has been meeting now with stakeholders. We have literally talked to thousands of people across the province about what that recovery plan needs to look like. So that means talking to every sector and looking at what the opportunities are in that sector, but what the damage has been. Of course, we continue to work with the federal government and with local governments. The Premier talked about local governments, but we are also talking to the federal government about what the priorities need to be to make sure that we're investing. So we are putting that plan together, but we're listening, and even as we're doing the work of reopening, which is critical, we have to understand this is also about restoring confidence. So one of the very important areas we've been focused on is what is it going to take, and Minister MacLeod is going to talk a bit about what we're doing in the tourism and hospitality and sports sector, but what is it going to take to restore confidence? It's not as simple as flipping a switch. People aren't going to just go back to restaurants or get on the transit because it's open. The transit has been running for some time, and you can see empty buses going by you right here around Queen's Park. So there's an issue of building confidence, what we're doing. There's an issue of listening, and then we'll have a plan that we'll put together. We always said that our March 25th plan was just our first step, but a plan that's going to recover the economy and make sure that we come back from this stronger than ever. I'll turn it over to Minister MacLeod.
Thank you, Brian, for that question. It's very important because I think what we're dealing with now as we recover in the economy is dealing with what I refer to as a triple threat. First, we dealt with the public health crisis. We still are. Then we dealt with the economic fallout. And now, to Minister Phillips' point, we're now dealing with the social sentiments and consumer behavior. And building back that confidence is going to be critical in each aspect of the ministries and the sectors that I support, whether that is hotel stays, going back to a restaurant, renting a kayak in Muskoka, or going back to take a walking tour in the city of Ottawa, where I'm from. That is going to be absolutely critical. And right now, based on the data that we're seeing and the experiences that we're having, it's going to take a lot of incentives to get people back into their old consumer behaviors. And that is going to be, I think, the biggest and longest impact of COVID-19 once we have the health situation contained. So one of the things that we're doing with respect to that is obviously making sure that I'm out on a province-wide tour to demonstrate the safety precautions that many of our small businesses are taking, whether that is a stay in a hotel up at Deerhurst in Muskoka, or a restaurant to visit in Gananoque, or even when it's safer to do so in the Southwest, making sure that those consumer behaviors are dealt with. But there will have to be some incentivization with respect to that, and I'm looking forward to working with my colleagues on the Jobs and Recovery Committee as we start to look at that. But I think that's our biggest challenge right now when you're looking at the triple threat of what COVID-19 has become.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi, Lisa.
Hi there, Premier. The first question is about Windsor. Windsor now has more positive cases in the agri-food sector than there were cases in long-term care homes in that region since the pandemic started. Your government made testing everyone a priority in long-term care when cases spike. So why not do the same for migrant workers?
Well, we're tackling that. We're going right across the province, and I'll get the exact number and get back to you tomorrow on the exact number of migrant workers that we're testing. We are down in the Windsor-Essex area testing migrant workers. First of all, they have to be willing to do it voluntarily. Secondly, their employer, the farmers, have to agree to it, and most of them are cooperating. So I know our chief medical officer has talked to them. I understand their concerns. Their concerns are if they test positive, they're going to lose all their workers, they're going to lose their crops. But I think the chief medical officer, with his communications, has a solution for that. If they test asymptomatic, they'll still be able to work, and we're all over this right now. And it's by the way, it's not the migrant workers' fault. I got to be clear on this. They came here, they self-isolated for 2 weeks, and they've picked it up since they've been here. So I don't want any finger pointing at these hardworking migrant workers. They're good people, they mean well, and they're hard workers too.
Follow-up?
Thanks, Premier. And I think my follow-up is probably best for the health minister.
Yep.
We've spoken to several gerontologists who say the province's long-term care visitation guidelines that you announced are overly restrictive and actually detrimental to residents and their family. These experts have also said the guidelines appear more concerned with the level of visitation these homes are willing to provide versus what's actually best for residents. So what's your response to this criticism?
Well, I would say that this is something the Ministry of Long-Term Care has worked very diligently on with the Chief Medical Officer of Health and the other medical health officers at the Health Command Table. It's being brought forward to recognize, first of all, that residents want to see family and that family want to see the residents, and they've devised it in a way that is as safe as it possibly can be, with making sure that people get tested before they visit their family members, that is being done out of doors, so nothing is being brought into the building by visitors, and that this is a solution that has had many considerations placed. Not everybody is going to agree on exactly everything that's going to be done during this pandemic, but this has been done by public health experts that are knowledgeable about the transmission of the disease, and they want to make sure that family members can see each other in the safest way possible.
Next question.
Next question comes from Travis Denrush from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. How are you doing? So I want to get back to the core question. I think Mark asked you about this, and so did Lucas. But how does this make sense in terms of preventing people from traveling? You know, what is to stop thousands of people to going down from Toronto to go down to the Niagara region, to Niagara Falls this weekend? What's to stop somebody from going from Toronto to Markham to a patio or to the barber? And I know that you say that you trust Ontarians to do the right thing, but is that not just wishful thinking? Because, you know, you were the one who said for weeks a regional approach was not the way to go.
Yeah,
right?
I agree. Yeah, no, I agree 100% with you, Travis. Someone from Peel could go down to Niagara. I don't disagree, and you're 100% right. And then I spoke to a lot of through the health table and chief medical officer and our MPPs were saying, hey, up in Vic right behind me, up in North Bay, there was very few cases. Why are we being punished for Toronto? And I heard it from Kenora and other regions, rural areas that didn't have the cases. And so we agreed. But I understand what you're saying, and hopefully very, very soon we're going to open these regions up. But I'll never disagree with our chief medical officer. I understand they spoke to the chief medical officer of Toronto, they spoke to the chief medical officer of Peel and Windsor. And I know 2 out of the 3, they said they just aren't ready. So I respect that. I'm not going to go against health advice ever.
So then what would you say? I mean, we saw pictures again this weekend of people not paying attention to the kind of social circle guidelines that were put out. There was a big gathering on Queen Street. I was out on the beaches. I saw a lot of people not paying attention to that rule. What's your advice to folks that are in Toronto, in Windsor, some of these areas that are still in stage 1, in terms of traveling this weekend? What would you tell people? What would you advise them?
Well, be vigilant. Don't let your guard down. You know, we aren't out of this by any means. God forbid we had a second wave in flu season. So I'd be very vigilant. Continue within your social bubble per se, and just practice social distancing. Even when you're in a group, you have to keep distance and wear a face covering when you can. You know, Toronto and Peel, very populated areas, are much different than rural areas that aren't as populated, that may not have the large gatherings. So I'd say please be vigilant, and the more you're vigilant, the quicker we're going to get through this. And the reason we have the numbers so low, because people have been listening. They showed me that chart, and I mentioned it before, but it's so impressive, and it's not about our government. It's about the people of Ontario. Per 100,000 cases, we're leading North America by far. If you compare us to large regions and states in the U.S., and I guess the only close comparator is Quebec and Canada, but because of the great work the people and the frontline folks have done, we're in much better shape. We aren't out of the woods by any means, but man, the numbers looking great today. We had over 21,000. I can't remember. I don't think I've ever been able to stand up here on a Monday morning and say we've done 21,000 tests. So thank you to all the public health folks and Matt Anderson and his team for getting out there. Mobile units. Talked to Mayor Brown this morning. He said, thank you for sending those mobile units into Brampton. It makes a huge difference. So things are running very, very well right now. People are finding the right track to go down, and they're working hard on it. So I want to thank everyone. It's all the people of Ontario that made this happen, not us.
Last question.
Last question comes from Randy Rath from CHCH-TV. Please go ahead.
Randy, how are you?
Good, Premier. I was out and about this weekend in Niagara and Haldeman, Norfolk, and I noticed that when you're out of the cities, very few people in grocery stores, hardware stores, lineups for food trucks are wearing masks. And none of the clerks seem to be wearing masks. Well, very few of them anyhow. Going into phase 2, is it important that people continue to wear masks in public?
I would say so. I really would. And it all depends on, I guess, where you are. If you're, with you and your family, obviously, that's different, but going into a really heavily populated area, I'd be concerned. I'd put a mask on, and that's my advice. When possible, wear a face covering. I thought you'd be happy as anything, Randy, for Hamilton. And we're opening up Hamilton.
Follow up?
Yeah, that is a good thing. And also, I guess for the tourism minister, a lot of these smaller tourism operators have taken a really bad hit so far. Do you have any way to know any estimate of what percentage of them are not going to make a comeback?
Well, right now, I think if you talk to the Tourism Industry Association, we're looking at probably around 60%, maybe a bit more, that have shuttered. I can tell you anecdotally, just since I've been to 3 communities, Ottawa, the Thousand Islands, as well as Muskoka over the past 3 days, the tourism operators just want an opportunity to be open. I think that Niagara is going to be very happy today as a result of that. That is a big morale booster. You know, that is what Glenn Shackleton of the Haunted Walks told me in Ottawa. So it's really important that way. We do estimate we've taken a $20 billion hit in the province. 40% of visitor spending in the province of Ontario occurs this month right up until August. So obviously we want people traveling in their own communities, and that's going to be important. And I'd like just to point out, in each of the communities that I have been to since last Friday with Phase 2 reopening, I have been impressed with each one of the operators and the level of physical distancing happening in each of those communities, the number of people wearing masks, the high degree of sanitation and contact tracing. Each one of these businesses wants to succeed, whether that is your local neighborhood pub or it is one of the nicest resorts in the entire province and everything in between. They want to succeed, and that's why we're continuing to support them, and that's why we continue to consult with them to see what the path forward is. And I think it's important to note, on the 12th of March, when the economy did hit, many of these businesses felt quite hopeless. And I think as we move into Phase 2, we're providing a great deal of hope, and I'm looking forward to some of the very creative ideas that come forward to support these industries. But it has been very dark days, but better days are to come, and certainly with this government and the Premier, we are committed to making sure that they come out of this.
Thank you.
Thanks, everyone.